Next, we're going to learn and look at language development with manual language or sign language. If their natural language is sign language, then we must look at that to determine their language development. And research to date has found that manual language development rather, is similar to those who are hearing, aided or unaided, acquiring spoken language. So we're not together, but I asked for you to stop and think about this. We're going to talk about this debate. But before I put ideas in your head, I want you to think, do you think that for anyone who is deaf or hard of hearing, that their best goal, that their target goal should be spoken language or sign language or both? um, and then why or why not? Really thinking to yourself, okay, I guess when I normally think about if a child is born deaf, would I think, what are we going to do to help them have oral language? Or would I automatically think that they should do sign language? It's actually pretty serious. It's not the word I'm looking for. It's actually a pretty personal and dear cause to the deaf and hard of hearing community. It's kind of split. Um, People choosing to live completely within a deaf community, meaning just signing, not trying to use any oral language, and then those who want to use oral language, and oftentimes those who use oral language are still open to sign, but they also want to use verbal speech. Um, and especially now with cochlear implants, when that became available, that really kind of split this group in further, because we have this technology to aid to where more than ever before people can have oral communication. And especially now that it can be implanted in children as young as 10 months old. And so even though it requires speech and language therapy, if you're profoundly deaf or hard of hearing, you're going to have some kind of outside resource if this child is born to hearing parents. Now, if two deaf parents who are completely committed to the deaf community and sign language have a child that's born deaf, they might not choose to seek any services because they can teach that child sign language. That's not always the case, though. Oftentimes, if there's two hearing impairments with a child born deaf, they're immediately going to have to go somewhere because they're most likely not going to know sign language or how to go along with a cochlear implant and speech and language therapy. When we talk about those that actually choose those cochlear implants, and like I said, looking at what language development is like for them once that's implanted, cognitively, we feel like it's likely similar. Um, their family life nurture looks a lot of like the same. They have good expressive and receptive manual language, so sign language is kind of the same. And that, again, if deaf children are born to hearing parents, they have good spoken language because parents are just going to use what they have. And then otitis media. This is really, really big. I mentioned this earlier. Overall, too, even if you have a cochlear implant, otitis media is literally a middle ear infection. And so if you remember that diagram again, your middle ear, it's connected to your inner ear, but it's separate. So you can have that cochlear implant that's implanted in your inner ear and still get a middle ear infection. And when there is fluid in that middle ear, your eardrum doesn't have the mobility it needs to vibrate, and those bones don't have the mobility they need to vibrate. And so not only is it painful and can become infected, but their hearing is lessened. So this video is going to show you a little bit more about this really common problem. This affects 2/3 of kids. My oldest had a few hearing infections, but my youngest boy, he had 4 or 5 where he had to go on steroids by age 9 months, and that's when he got ear tubes. And so I think when we hear about middle ear infection and ear tubes, most of us that have worked with children in any capacity have kind of heard about those things. And this is just going to explain to you how that fluid fills the middle ear. And essentially, when you get a little tube in your eardrum, lets that fluid drain out. This is a really big deal because, again, if I'm doing a kindergarten screening and I check that child's hearing, and part of their health and family history, anyways, I ask is about hearing or middle ear infections because if they have kind of reoccurring middle ear infections, they most likely are going to have some speech issues. So, why this matters to you as a teacher, particularly in early childhood or with kids who are severely disabled and might not be able to tell you what's going on, they're going to have frequent colds. They're going to have fluid occasionally leaking from their ear because that fluid can actually make your eardrum pop or burst. They're probably going to be cranky because hearing infections are incredibly painful. And then, if you have that kid that you just feel like, I don't think they're hearing me as well, especially if you see it change or you notice all these other things, that could be a sign that they have a middle ear infection. And that's going to impact their language development and their social development overall. So we all kind of play a part in that.